Well, I first became interested in value-based healthcare when I was practicing as a general practitioner in South Wales. And to be honest with you, it was born out of a frustration that we didn't seem to be optimally using our resources to meet people's needs in the community. And that this seemed to be, something that was quite invisible to the system. I then had the privilege to go to Harvard and to take the executive education course taught by Michael Porter and Bob Kaplan. And, the penny dropped for me really that, gosh, we didn't really think about outcomes, certainly not outcomes that matter to patients, when we were assessing the success or otherwise of our healthcare systems. So if you don't know what your outcomes are, how do you know whether you're investing in the right things, whether you are delivering a good service? It's not enough that people have a good experience. We need to know that we are getting good outcomes. And of course, that's also really important when we want to think about driving equity in healthcare systems as well, which was a topic that I was very passionate about as a GP in South Wales. So over time then, over the last 12 or 13 years or so, I've been on a journey of trying to drive value-based healthcare and its implementation in Wales and more latterly around the globe. And I think the important thing to say about that and about my relationship with ICHOM specifically is that this is a team sport. We can only drive forward value-based healthcare and increase value in health for patients, increasing outcomes, improving healthcare system sustainability if we do it together. And we need to do that as a global partnership, and ICHOM's role in that is absolutely key. The biggest barrier to achieving value-based healthcare is a cultural one. When I started implementing value-based healthcare, there were lots of practical barriers. For example, the digital capability of organisations and the way people view data. That's changed beyond all recognition over the last 12 years, I would say, very much accelerated by the pandemic. But there's huge entropy in healthcare systems. Lots of people want to continue doing things the way we've always done things around here. So it's really a cultural barrier and barriers of resistance to change and fear of change, I think, that is still the biggest barrier. And that's why it is so important that we have this multidisciplinary, multi-organisational collaboration towards achieving value in health, because it's through that diversity of collaboration that we will achieve the momentum to overcome those change barriers and finally change culture. Well, I think one of the things that concerns me about the way that some organisations speak about value-based healthcare is that it is only, the onus is only on the clinician to make value-based healthcare happen, and that if patients don't get the outcomes that they want or deserve, that is purely down to whether there is technically excellent care by the clinician. And of course, that's not true at all. Technically excellent care is definitely required to achieve the best outcomes that matter to patients, but it needs to be a partnership, doesn't it, with the organisation. So we need to make sure that, for example, clinicians have adequate time with their patients. That's an organisational core condition for value-based healthcare, and we need to make sure that we have the right infrastructure to support that. So whether that's digital and data infrastructure or the interventions that clinicians need at their fingertips. So we need to make sure this is not placed only on the shoulders of clinicians, important though clinicians are. And the second thing I would say about the clinical involvement is one of data literacy. So we need to become much more comfortable with using technology and data to supply information to patients in a way that is meaningful to them, to help them make the best decisions about their own health and care. So that's the second thing. And then the third thing with clinicians, I think, is that we need the humility to involve patients as partners in their care and eradicate any last traces of paternalism that we see in healthcare systems.